Every child needs to be supported in the best way they can to be the best version of themselves possible. And that's the job of the parent, the pediatrician, and the educator. So the good news is, parents out there, you are not alone. We are here to help you. My name is Kerry Fierstein. I'm Chief Executive Officer of Allied Physicians Group, a practicing pediatrician in Plainview for over 30 years, mother of 3, and grandmother of 1. Allied Physicians Group is a practice without walls. We consist of about 30-something mostly pediatric practices in Lower New York. We take care of 150,000 plus children. We have 150 clinicians. Mental health has become one of our major focuses. So we want you to know that we're not just there to take care of your child's sore throat and belly aches and now COVID symptoms potentially, every cold that could be COVID, but we are also here to help you raise your child in every aspect, including things like ADHD and anxiety. Now that we're back in school, some of these things are coming more to the forefront. This hopefully will be a normal school year, whatever that means, but that also means that we need to start looking at our children and how they learn and what they're doing and getting back to the business of helping them in the best way we can. So tonight, I have a wonderful panel of pediatricians. And sometimes people wonder, why it's the pediatricians issue. And really over the past 10, 15 years, mental health issues like ADHD, anxiety, and depression have become the purview of the pediatricians. There are not enough neurologists and psychiatrists and psychologists on the plans or even outside the plans. And the truth is that we know your family, we know your children, and that relationship is really helpful, at least at the beginning, to figure out what you need, and then we may be able to take you right through. You may need to get some extra help. So tonight you're going to be hearing from Dr. Marc Lashley, pediatrician, and I will let him introduce himself.
Hi, everybody. As Dr. Fierstein said, I'm Dr. Marc Lashley. I've been practicing for over 30 years pediatrics. I practice in Valley Stream at Valley Stream Pediatrics and in Rockaway Park in Island Pediatric Associates. I started to realize as a pediatrician, as Dr. Fierstein said, that there was no place to send my patients for mental health because either the psychiatrists weren't accepting insurance or they were overloaded. So all the pediatricians really started picking up the slack, getting extra training and learning more and more on how to care for children with mental health issues. Tonight, we decided to focus our talk about things that might go wrong when school starts, because school's starting now, so it seemed like a really timely topic. I'll be speaking about ADHD and how to know if your child might have signs of ADHD. And Doctors Montague and Parles will be talking about anxiety. We figured these are the top 2 real problems that are the most pervasive that children of school age are experiencing, especially younger children. So if we could have the first slide, Brianne.
Well, why don't we let Dr. Montague and Dr. Parles introduce themselves first, and then we'll be able to go right through the program.
Yes, thanks, Kerry.
Janice?
Thanks, Dr. Fierstein. I'm Dr. Janice Montague, also a pediatrician, been practicing about 25 years in private practice in Rockland County. And I became interested in behavioral health for exactly what the past 2 speakers just said, because there weren't enough therapists, psychiatrists, people that I thought during my training would really take that on. I also was a psychology major and I love behavioral health in my training as well. And I just started to really listen to my patients and realize that so much of their growing up and so much of what they encountered, whether it was with sports or school or family life stressors, caused anxiety, depression, and obviously other life stressors that caused, lots of mental health. And I began to realize and say to parents that we see you guys for sore throats and all those other things, but I think the commonality between most kids is the stress, and especially once social media came on board and all these other stressors for kids, that this became a really hot topic for me, and I'm glad that I learned more about it and I'm able to help my patients.
And Dr. Parles.
Sorry, I needed to unmute myself. So I'm Jamie Parles. I'm a pediatrician. I also been in practice for 30 some odd years. First 28 years as a general pediatrician who had an interest and then a dedication and then a mission that pediatricians need to be involved in common mental health problems in children. And as I fulfilled my mission more and more, I came to realize that families were really having a hard time finding the care for their children, which fortunately has changed quite a bit for many allied patients. But 5.5 years ago, I started a practice doing exclusively pediatric and some young adult mental health work. That's what I do now as a as an uncredentialed specialist working in the field of pediatric mental health. And thank you for joining us tonight.
Great. Dr. Lashley, why don't you start us off?
Okay, so I almost jumped the gun there. Thank you for slowing me down. We circulated the topics we were going to talk about, and a lot of parents sent in questions before the webinar started tonight. And we were looking them over together, and we saw that overwhelmingly people are very concerned about how ADHD is diagnosed, how early it can be diagnosed, and what can we do, not just besides medicine, what can be done. So let's have the first slide, Bree. So, if we look at the diagnosis of ADHD, it's almost always made at age 7 or above. That doesn't mean always, but almost always. We do see sometimes very clear signs in younger children, as young as 5 or 6, that they might be heading in the way of the diagnosis. We tend not to make the diagnosis before 7 too often, but if a child is having florid symptoms, we will make the diagnosis early or start treatment early because their lives are so disrupted. So 7 is the golden year when we really start to look at it. And by then, the teachers have been weighing in that there's something different about this child, something going on here. The parents know that there's really something different about their child. So first and foremost, we want to know, is the child having academic problems? It's very hard to diagnose an A student with ADHD, although we do sometimes. It's mostly about functioning. So if a child's functioning really well in life, socially, at home, and at school, it's hard to make a case that they have a disorder. Most disorders are diagnosed because they impair functioning. So academics are the number one thing we look at with ADHD, because if someone's inattentive, it's very hard for them to succeed. And everything's in a continuum, right? There are children that are very mildly affected and very severely affected. And sometimes I have a child who's inattentive and very hyperactive. And I'll say, if you were growing up on a farm in Kansas, it would be very different treatment plan than if you're living in Manhattan, on Fifth Avenue. So the situation that the child's being brought up in and living in and having to function in is very important in how we make the diagnosis. So academic difficulties usually brought up by the teacher. Often the parent can see that beforehand. Making careless mistakes, like you just can't believe. All children make mistakes, but more than the average amount. That you can't believe you just told your child this. Maybe there's poor retention of material, like you taught them something or explained something and they need to have it explained over and over. They're just not keeping it in there. It's falling out. even when you speak to your child directly, they don't seem to be paying attention. So you're right in their face, you're talking to them intently, doesn't have to be with anger, but with purpose, and their mind is elsewhere. They might even be looking at you, but the attention is not there. There's, as we say, the lights are on, but no one's home. Even when you try to have them maintain their attention on something, they have difficulty doing so. Now, I have a lot of parents say, you know, how can my child have ADHD? He can sit and play a video game for 4 hours intently. It's interesting, and I sometimes think that ADHD is poorly named because it's not so much that you can't pay attention, is that when anything requires mental effort or is difficult, the child will shy away from it who has ADHD, will not be able to pay attention, whereas something that's pleasurable, they can do it all day long. So you can't go by the fact that they might be into their video games or a task that they enjoy. It has to be something that's new or difficult. It takes them longer to do things, and this can be really observed by the parent at home. You see that the child can't get ready in the morning, or that you tell them to do a task and it's reminding, Stuart, did you do that? Did you do that? And especially if there's multi-step tasks, like take your clothes off, put them in the hamper, and get ready for your bath. They might have heard the take your clothes off part, and then everything else is out the door as far as their mind goes. So multi-step tasks can be a problem for them. And next slide. The other component of ADHD is hyperactivity, but hyperactivity is not always present. As a matter of fact, we now divide ADHD into 3 kinds: inattentive, hyperactive, and then combined. So there are children that, a small subset of children that are just hyperactive and don't have too much attention problems, although I haven't seen a lot of that in practice. There are children who are just inattentive and can sit quite still. That's more common in girls, as a matter of fact. Boys more likely to have combined, which is where they're hyperactive and inattentive. The hyperactive part is sometimes not so much your body moving, but can be reflected in impulsivity. And that means that the child has trouble waiting in line, waiting their turn, blurts out things and interrupts other people, not because they're rude, it's just because they had this amazing thought and they just can't keep it in, and out it comes because they have trouble waiting. So that is sometimes a sign. And all children do some of these symptoms to some degree. It's when they're an outlier that they people recognize them as doing it a lot more than the average child. Disorganization. You might say, well, how is my 6-year-old disorganized, or my 7-year-old? Well, are there clothes all over the room? Are there toys everywhere? Even when you try to rein them in and teach them how to clean up after themselves. When a 7-year-old comes with their book bag and papers are flying all over the place instead of in their folders like they're supposed to be, that's a sign of disorganization. Losing things, misplacing things more than the average child. Leaving their seat when they're expected to do so. A lot of times we hear kindergartners, or even in pre-K, the teacher will say, this child cannot sit in circle time, or has trouble sitting down, or waiting their turn. And seems to be driven by a motor, is not something that psychiatrists came up, but really what parents have told us. My child is like the Energizer Bunny. Nothing slows this kid down. This kid is on, Duracell batteries in here and really doesn't stop going. Or very talkative. And we find talkativeness is very common in ADHD, both in boys and girls, slightly more in girls, but being very talkative is a sign of ADHD. To sum up, we generally diagnose it around age 7. We look for signs of inattention more than the average child. It can involve hyperactivity, but not always. And almost always there's impairment. Now, sometimes the impairment is not just in school, it can be at home. I have a lot of parents telling me that their child is disrupting the family. They can't have meal times. They can't have quiet times and enjoy times together, go to movies or church or religious services. And a lot of their lives are disrupted in many ways. And when we're diagnosing it, we're really looking to see if it's just in the school setting or just in the home setting or in both settings. And very telling when it's in both settings. We have ways of measuring a child's ability to pay attention and their impulsivity and hyperactiveness. They are scoring sheets called Vanderbilt forms or Connors forms. They're really just behavioral checklists with a score of 0, 1, 2, 3. And we give them to parents and teachers, and we ask them to fill them out. And we look at the scores, and we can really see on paper all the different behaviors that the parent and teacher feels that this is over the top more than the average child. And that's how we go about making the diagnosis. Brianna, I forget, is that the last of my slide? Okay, that's the last of my slides. So we purposely kept what we had to say as doctors in our presentation very short today, because this is not our first rodeo. We've done a few of these webinars already, and I'm going to keep my opening comments very short because we have so many questions from parents, and you're free to use the chat box at the bottom of your screen and type in questions. And Dr. Fierstein, at the end of what we're speaking about, will go through what we see are the most common questions that come through, and we'll also try to answer them in real time as we're talking to some of your answers. After the session, we might also collect some of the questions and email them out to participants. So that's what I have to say about ADHD and recognizing it in children. Now we're going to talk about anxiety, which is also a very big problem in school-age children starting school for the first time, and in September. And you should know that anxiety is the #1 comorbid or associated condition with ADHD, that more than half of children who have ADHD also have anxiety. So we're going to talk about that as well right now. Dr. Montague, I'll give it off to you.
Thanks. And that's a good segue, because I agree. I have lots of parents who come in and I tell them all the time that it's very hard to sometimes separate what ADHD symptoms are versus anxiety. They can also be like sort of hyper. They cannot want to sit. It's hard to focus. And I always tell kids that are old enough to understand that if I felt anxious, I'm talking to them because I'm waiting for a test result to come back or my family member's sick, that I wouldn't be able to pay attention to them as well as other people could, or when I'm not anxious or I'm not nervous about something. So it is a really difficult thing, which is why I like doing this together. And some kids have both. And sometimes I've noticed I treat the ADHD and all the anxiety comes down because they have such problems with what we call executive functioning. And that once we get them to focus and function, their anxiety levels go down. So they don't often need lots of medicines. Sometimes they just need one or the other. And sometimes they just need counseling, which is obviously what we'll get to when Jamie speaks. But Bree, can you go to the next slide? Thank you. So I thought we'd start with some general symptoms of anxiety, which of course we've all experienced. I always tell kids we want to feel a little nervous, a little anxious, because if a bear is chasing you, and we do have bears around where I am. So if a bear is chasing you, you need to have a little bit of stress hormones that may make you feel irritable. But obviously if that crazy feeling of nervousness or irritability is more long lasting than just running away from a wild bear, then that could be upsetting and interfere with your daily routine. And that's another commonality, is that is it interfering with function. So having this impending sense of danger or panic or doom, but you wake up in the morning and they feel that way, but then they get on the bus, they go to school and they're fine. Well, okay, that's probably just normal. I'm starting school and I feel a little nervous, and we should tell them. And I love to normalize fear for kids, because fear is normal. And it's really saying to them, of course you're nervous, you're going to school, you haven't been in school in a long time. We've just had a year and a half of like crazy changes in school. They don't know where they're coming, they're going, they're in school, and being able to normalize that anxiety for them is so good, but also to tell them, hey, we'll talk again later. We're going to check in later. We're going to see how your day was and how you feel. And if it's really more like you're noticing your kid is not normal, they're really tired all the time. They're complaining. They don't want to do things. They feel like they're nauseous. A lot of kids will have a lot of nausea and dizziness, which is an interesting thing because parents often come to us with that. And of course, the medical doctors and us are going, okay, well, are they sick? Do they have a virus? Do they have other things going on? Is their blood pressure okay? But a lot of kids actually experience nausea and dizziness, and they think that it's actually their motion sickness on the bus, or they feel dizzy when they're in class, and it turns out it's anxiety. A teacher might call you up and say, hey, you know, this kid is really not concentrating. I think he has some attention issues. And it turns out, as I said before, they really just can't concentrate because they're so nervous. Whether they're nervous, they're older kids, they're nervous about their social situations at school, or they're younger and they're nervous about a math test, or somebody's bullying them, or they just have what we call generalized anxiety, which is just overall feeling of unwellness, feeling like they might be like hot all the time, sweating, nauseous, dizzy. I don't feel good. A lot of these kids will just say, I don't feel good. I don't feel good. I don't know. I don't feel good. We have the chronic belly aches, right? And I had a kid in today, and, you know, we do all the right stuff. Are they constipated? Are they eating? Are they allergic to anything? And then, you know, you start really talking, and what do you find? That parents are thinking about moving, or, you know, there might be a death in the family. And it turns out that stomach aches are real. And I really try to normalize that for people, because I don't want kids to feel like I think they're making it up. They're not making it up. People in general can have all kind of physical symptoms when they're nervous, right? We have a headache. Like I said, we could be dizzy, but kids often get belly aches. My belly hurts, my belly hurts, my belly hurts. They might vomit, and it doesn't mean that they're physically really sick, but it could be starting in their brain, and then it affects them physically. And that's really hormonal. But they learn through what we're going to talk about later, skills and coping skills, to make those symptoms less for themselves over time. A lot of kids, you know, at the beginning of school, I get the always in my bed. They start school the month of September. The kids go into, they lie down, they go to sleep, they wake up, they're in their bed. They're mommy, mommy, daddy, daddy, waking them up, bad dreams, putting them back to bed, coming back and forth. That is normal. What I tell parents all the time is sometimes you just have to figure that out and reassure them. And then they go back in their beds. And if it's prolonged and it's like we're into October and November and December and it's still happening, then clearly that might be. But that's a really common sleep trouble in kids. Is a very common sign of anxiety. You can go to the next slide, Bree, thanks. So there's obviously different, I always think it's really interesting in early childhood and later childhood to talk about, like, toddlers even can have anxiety. They can cry a lot, they can have separation anxiety. You drop them off in nursery school, and the first few days, the first week, it might be difficult, they cry, but is that prolonged? Is it every day for a month? When you go to grandma's house, do they cry every single time you leave? You know, toddlers that are also just like super clingy and only want one parent all the time to make it's sort of like that's their transitional object. It makes them feel better and it calms them down. We often don't know this is anxiety till we sort of retrospectively look back, but it's very common in little toddlers to say, oh, you know what, he also has these crazy transition issues in nursery school, and when they go from circle time to outdoor time, he has a complete meltdown. And those kids also, it creates a lot of anxiety when they transition, whether they're going to grandma's for the night or they're transitioning in nursery school. So that's something to pay attention to as well. Little kids, like I said, can get stomach aches and sleeping issues. You know, they regress a lot. Sometimes something might happen to make them anxious or upset them or scare them. And then, of course, you might see that they were completely fine. And next thing you know, they're sucking on a pacifier or their thumb, or, you know, crying when they used to not cry. And later in childhood, you know, they get a little more moody. They just like, nobody likes me. I don't want to go to school. I hate school. But meanwhile, they used to skip onto the bus every day, go to school, bye, I love you, and they're out the door. But sometimes if something's going on with them, they say, I don't like it. I don't want to do it. I hate soccer. What do you mean you hate soccer? You always played soccer. And then, you know, trying to figure out, did something happen at soccer, or is this an overall, I'm upset and nervous about life in general, which, you know, basically, I think just getting back to that COVID-19 thing, kids, I've noticed, and I think we all know because therapists have a 4 to 6 week waiting period, and we have such an increased need for mental health because kids are nervous, and they're nervous. They're going to go to school. They're going to get COVID. I'm going to give it to my mommy. Am I going to, you know, be okay? Am I going to get COVID? They really, I think that this has added such a big layer to our kids, school age kids now. And I don't blame them. I get it. And we try to normalize it and tell them that, you know, most kids are going to be fine. They're not going to get COVID. They wear their mask. But in general, it's, I think, added a whole new layer to anxiety for kids. Again, older kids can have difficulty concentrating. They can have some separation anxiety. They might just not want to be with people that used to make them happy. You know, overall, I think we really need to know that anxieties, mental health disorders, 20% of all kids are affected with mental health disorders. So 8% or so with anxiety, and it's very common. It's not an uncommon thing. So recognizing it and making sure, checking in with your pediatrician, checking in with the teachers, if you know, if they're school age we don't usually have anxiety in kids that are much younger than like a preschool, school age, teenage years, but asking, how's at home? He's just been moody and different. How's he doing in school? And that might help you think, realize, is it school? Is it home? Is it everything? Is it in different places? Some kids, we know the whole thing with anxieties is sometimes generalized to everything, or it could be school, or it could be social, or it could be, we have a lot of school-based anxiety right now, especially, but we've always had school-based anxiety, kids refusing to go to school, or kids who had a bad episode, something happened to them at school, they might not want to go to school. And I think teachers are super important. There's lots of things to do at school as far as, counseling and special programs for kids to get involved in as well. Do I have another slide there? There we go. So I think I was supposed to touch a little bit on depression. We're just going to say quickly, though, because I think this is more anxiety or ADHD, that for me, I noticed a lot of my anxious kids have some depression qualities. Some kids are just depressed, of course, but I wanted to say that if you're super anxious and you're super anxious for a long time, kids start to lose faith. They start to lose interest in activities. They start to not sleep well, they not eat well. And next thing you know, those are a lot of the same symptoms that we see with depression, right? They don't feel good about themselves. I'm not like everyone else. I'm not as good as everyone else, because they're so anxious. And then they just start to have no faith in themselves. They don't feel like anybody's helping them. They might just stay in their beds all the time. They might not want to go to school, leave the house. So we always have to sort of be on the page of, where does this anxiety fall? Is it anxiety in just one area? Is it affecting their overall life? And are they sad? And then at what point does that sadness come towards suicidal ideation? And when do we really need to intervene in an emergent sort of way? So I just wanted to touch on how those are related. And I think that that's it.
Okay, I think it's my turn. Brianne, we still have, I think, Janice's picture up there as opposed to mine, but I'll start talking. So, it says approach to child with anxiety, and really what I'm going to talk about is the approach to a child or adolescent with any of the problems that have been discussed tonight. It's really what should parents do, when their child has a problem. What can and should they do? I want to make some reference to the pandemic, to COVID, because obviously it has been a major factor in everybody's life over the last year and a half, and especially our children. It's increased stress, and during the time when a lot of kids were doing hybrid or at-home school, a lot of kids with mental health problems suffered, had real hard time without the structure. As kids have gone back, kids with social anxiety, who were perfectly comfortable at home in their basement watching the screen for TV, now have to, re-enter the world, and after being shielded from it for a while. So kids with social anxiety may be having more problems as they have more structure, as opposed to kids who tend to do better with more structure. The role of stress is really important for any of the disorders that we're talking about. Stress makes any mental health problem more difficult by asking kids to cope with more things in their mind at once than some of them can handle. A perfect example of that is a child with ADHD or certain types of anxiety that has a great time during the summer. You never know there's anything wrong with them, and then when school comes, they're stressed, and their symptoms start appearing all over again, and they start to show evidence of the things that require intervention. And so that brings me to one of the central questions that I feel I have to answer is, when does a parent know that they need to intervene and get help for their child with symptoms of a mental health disorder, whether it's ADHD, whether it's anxiety, depression, or anything else on the list? And I think there are two factors. Okay, one is when there's a loss of, there's a meaningful loss of function. When a child or teenager is not either able or willing to do, or just not doing things that that they need to do or they want to do. When they have trouble doing their daily activities that they're expected to do by others, and they usually expect to do themselves. The other one is if a child or teenager is showing signs of distress, that if they are showing a degree of emotional discomfort on an ongoing basis that is unusual for them or unusual for someone their age. And I'm not talking about a bad day. I'm not talking about a bad few days. I'm talking about, a real change in your child's mood or behavior or demeanor. And, so that, in those situations, those are the times to call somebody and ask for help. I think a good first place to stop is with your pediatrician and ask for advice. Let your pediatrician know what's going on, and your pediatrician can usually help you, figure out what might be going on and steer you in the right direction, whether it's to their office or whether it's to a therapist or to a medical doctor who treats mental health disorders medically. Treatment of mental health disorders, I think, falls into two broad categories. There's medical and non-medical. There are roles for both medical treatment and non-medical treatment in some children or adolescents. For example, most children almost all children with ADHD that are showing signs of impairment need both medical and non-medical approaches to get better. Children with mild anxiety disorder or mild depression can improve and return to their normal state of well-being without medicine, with appropriate talk therapy. A particular kind of talk therapy called cognitive behavior therapy is the one that has the most evidence behind it, but with effective psychotherapy, many people with mild anxiety or depression can improve. Once you get into the moderate plus categories of either anxiety disorder or depression, the rate of improvement with psychotherapy alone without medicine starts to dwindle. So people, children and teenagers with more severe varieties of anxiety and depression often will need and benefit from medical treatment. I think at that point, again, your pediatrician is your best resource to help you make referrals to an appropriate therapist, which could be a psychologist, could be a clinical social worker, and or to a psychiatrist or other type of specialist that treats disorders medically if the the severity or complexity of the problem is outside of the scope of what your pediatrician is trained to treat or feels comfortable with. And that varies a lot from pediatrician to pediatrician. Like Janice said before, and I think Marc said too, a lot of kids with one disorder have multiple disorders. Anxiety and depression tend to go together. Anxiety and ADHD go together. And evaluation of kids with those two disorders can be complex to understand, which symptom of which disorder is causing what degree of distress or dysfunction in a given child or teenager. And someone who is good at treating these disorders, the first thing they do is they get to know your child as well as possible. Because mental health disorders are not just a list of symptoms that you can check off on a checklist and come up with a recipe for what to do next. If we could do that, computers could do it. You wouldn't need doctors. In order to know what the purpose of a mental health symptom is, the clinician really needs to get to know the person with a symptom so they can understand what's behind it and how to help them solve it. And then the last thing I want to say before I turn it over to the question and answer period is teen suicide is an increasing problem in the country. So if your teenager or pre-adolescent is showing signs of depression or showing signs of severe anxiety, if their behavior has changed, if they're not right, ask them if they are thinking about hurting themselves. Ask them if they're thinking about not wanting to live anymore. We really don't want that to be a surprise, and that approach in the home can be life-saving. We do not make teenagers more likely to act on suicidal impulses by asking about them. We don't put those ideas in teenagers' heads. They're either there or they're not, and if they are, that means that that adolescent needs accelerated help, not thinking about it for another few weeks. Okay. Thank you. And I'm going to turn it back to, I think, Kerry for the Q&A.
Yep. Thank you, everyone. Really great information. And you could see the questions that are coming up that you started people thinking a little bit. So, Janice, this one's to you. Our society values, okay. Our society values early intervention. Are you hearing feedback?
No.
So maybe it's you, Janice. Okay, better. So our society values early diagnosis. We have this whole early intervention, area set up to get kids help as early as possible. I had a question sent in. How could you tell if a newborn has ADHD? And I see a lot of parents, and maybe an older child has ADHD, and they see these signs in their 2- and 3-year-old. And I think the real question is, how important is it to make the diagnosis as soon as possible? And, what does the parent need to be looking at?
All right, hopefully that feedback's gone. I think somebody's doing something back in my house, telling them to be quiet. They're not listening to me. So it's funny because that kind of question like always makes me laugh a little bit, because I feel like every baby is inattentive because it's all about them, right? They're just sort of, they look at what they want to look like, they want food when they want it, they want to poop when they want to. So I think that's just, it's funny, but it's also interesting because I agree, I'm all about early intervention services, right? So we get them through our counties, and I refer kids all the time, whether that's through the county or privately or whatnot. I'm about recognizing things. So I think it's more about, is there something about your child's behavior, just a general overall behavior? If my daughter was listening, she'd be mad, but my daughter, when I look back, who's anxious, was very clingy toddler. And she also has a medical issue, but we look back on some of these things. And so of course, as she got older and I started to realize some things that were going on, and I said, well, wow, I looked back at that. That's why she always wanted mommy, 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 because I made her feel better, because I was, as I say, the transitional object. I just think it's important for us to, as doctors, bring it up with your pediatrician. If there's anything behavioral about your child that's bothering you, whether he's clingy or he cries a lot, or he seems not to be attentive, or eye contact or following you, I think that that's something to always talk about it, whether it's ADD or anxiety or any other developmental disability.
Thank you. Dr. Lashley. So a lot of parents homeschooled last year, and for some kids with ADHD, it was a disaster. For some kids, they seem to do great because the parent was able to tailor the schedule to their needs. And I guess the same with children with anxiety. And now that they're going back in school, the parents are starting to see difficulties again. And the question came up, is homeschooling better for a child with ADHD?
So that's a loaded question. And my answer is that it's all over the map. I've had ADHD children do better with homeschooling. Why? Because they're not in a classroom full of 30 other children, distracting them with all the colorful things on the walls and all the events going on in school. Make no mistake, we think school is where kids should be. And that kids thrive when they're in school. We're trying to protect everyone and keep them safe. So sometimes homeschooling has become necessary, but yes, I have kids who do better on homeschooling, but then I have children with ADHD that just can't relate to the flat computer screen, and that it's not relatable to them, and they're distracted by things in their own room, or they lose their attention because it's not engaging enough for them to be staring at the computer and do their work, that they need the intervention of a real person to be there. And that's where the parent comes in. So parents didn't stop their lives, they're working. Maybe the mom has other children in the house, or maybe she has a job she has to go to, or dad is the one that's at home, and they can't always be there on top of the child, helping them get through the school. So it's very hard for some ADHD kids to pay attention to the screen. So I've taken it in my practice in a very individual way. I've assessed each child who's in school or not, getting those Vanderbilt assessments I talked about before, checking with the parents and teachers and finding out how is your child doing with whatever school situation they're in, and then tailoring the treatment to each specific child. There's no such thing as a cookie cutter answer here.
Yeah, everybody seems to be saying that. There's no easy answers to this. And I think that's why it's important to have a discussion with somebody who knows your kid.
Yeah.
Thank you. Dr. Parles. My 15-year-old is showing some of the signs that you guys talked about tonight. Is it too late to diagnose him with ADHD?
No. No. I mean, there are adults who are diagnosed with ADHD. It's never too late. Even though if you look at statistics, the ideal time to diagnose and treat and start treatment for ADHD is when kids are younger, so that they can go through more of their developmental stages with a lesser degree of impairment. Okay, it's never too late, because You can always catch up and learn things that you don't know yet, that allow you to have to function better, have a better quality of life. And when I say learn things, I'm not talking about academic things. I'm talking about life skills, coping skills, how to manage your way through day, week, month, year. And I have parents, not I have parents, but my patients. I have patients with parents who have come to me and said, since you started treating my child for ADHD, I realized that I was just like him or her as a child. I went to see the doctor. I have ADHD. I'm being treated for ADHD, and my quality of life is so much better than it was before. I can do things that I could never do before. So no, there's no such thing as too late, within reason.
Thank you.
I mean, my grandmother, I'm not sure I'd refer for treatment. Yeah.
Dr. Montague. This was, my son has difficulty concentrating on homework after school. He has trouble focusing and sitting in his chair. He's 7 years old. Previous teachers have told me that there are no issues in school. Is this just typical little boy behavior, or is this a sign of something else?
I think you could say both things. I think that it's not just boys, girls are like that too. And I think that it can be because they're tired and they really don't want to sit in their seat and do homework after school. So for some of those kids, I say, listen, why don't we give them a break? If I was a kid, and even as an adult, I need to go outside and play. They need a snack. They need to relax. Sometimes they need to rest the brain and then come back when they're, played outside for an hour, had something to eat, and sit and see if they act any better. I really find that 8 hours of school in a 7-year-old, they're not ready to sit and do homework after school. I don't think they even should. I think that's a long day for them. And studies have shown that kids need more recess time than we give them, and that they actually function better in school when we give them more recess. So think of that as the recess time after school. On the other hand, if, one of you guys spoke about how we don't always have ADHD just, in school. Sometimes it is just in the home. I have parents all the time who say, oh gosh, the teachers are, he's fine. But at home, he will not sit. He won't eat. He won't sit at the table with us. He won't watch a movie with us. He's always running all over the place. And that could actually be anxiety, right? It could be ADD. It could be that at home he's distracted by something, or he worries about something, or the thing that I know about ADHD that happens is that kids specifically who have a pretty much a high IQ and high functioning, they can function most of the day without medicine. They do really well until they get home and they're exhausted. And so that parents will often say they crash at the end of the day. They're often moody at the end of the day. They feed them. It doesn't help. They let them play outside. They're moody because the brain with ADHD has to spend so much more time organizing itself, paying attention, working harder to pay attention. For the amount of energy that I expend and this little kid expends is much more, so they're exhausted. So to ask them to sit there and do a math sheet or do their reading for 20 minutes may just be at the point where his ADHD is just kicking in then because he's done it and he's exhausted. What medicines tend to do is they help actually spread that brain power, I always sort of call it, throughout the day, and relax them and let them concentrate at 9, at 11, at 3, and then they come home from school. And although sometimes they're coming off meds and they might be a little more cranky, sometimes, very rarely, but they feel like, oh, I feel better at the end of the day. I don't feel exhausted. And I have teenagers who, just getting back to that, is it too late to diagnose that I start on meds, who say to me, I used to come home from school every day so tired, my brain hurt. And we put them on medicine and they're like, I can go to my sport. I can go to work. I took a driver's ed class and they don't feel, I had a kid the other day, she said to me, I don't feel so nervous to start my afternoon now. I actually feel like I have a life outside of school. So it's hard to say about a 7-year-old, but I do think you just keep your eye on it and try to let him have some downtime and play and be a 7-year-old. And then if it continues to become an issue, I think definitely talk to your pediatrician.
Yeah, I think also as a parent, you can decide that your child doesn't have to do that much homework when they get home from school, right? That is your choice. You can kind of tell the teacher, we're going to do a half an hour and that's it. Whatever he gets done, he gets done. That whole permanent record thing doesn't really follow you for the rest of your life. So you'll be okay. Okay, next question. This is to Dr. Lashley. And somebody else asked a similar question. So this one is, where am I? No. Oh, I think somebody may have answered that question, probably Dr. Lashley, but I'm going to give it to you anyway. My son was referred to an outside program to get his ADHD diagnosed by school, and it was very expensive. So we didn't do it. And somebody else said that their school told them that the child has to have neuropsych testing by a neuropsychologist to make that ADHD diagnosis. So is this true, or can I really just go to my pediatrician? Can it be that easy?
The answer is yes, it can be that easy, but right now we're preaching to the choir. I mean, this group of pediatricians has had the training and is vested in it. Not all pediatricians out there have the training and feel comfortable diagnosing and treating ADHD. I can tell you that I'm very proud of our group, Allied Physicians Group. I think more than half of us have gone through the training. So if you're an allied family, you can certainly go to your lead physician in your office and say, if you don't feel that you can diagnose my child's ADHD, I understand there are other allied docs out there who can. And right now, we're talking virtually. A lot of this can be done virtually as well. You don't have to travel very far. So I'm sure your allied physician can get you an expert in ADHD if they're not one themselves. I don't know why, but it's so frustrating to me when school districts tell parents they have to go to a neurologist or they have to go to a neuropsychologist. I used to hear that in the 90s when I started practicing, because that was true then, but it's like they never changed with the times. And I don't know if the parents out there know this. I'm sure you probably do, but it can be $3,000 to $5,000 to have your child properly diagnosed by a neuropsychologist and get a battery of testing. Dr. Parles is going, no, I'm too low, higher. Well, I don't know many people who can afford that or are willing to pay that, and it's not necessary. It's not brain surgery, to use the expression, to diagnose somebody with ADHD. Sometimes it could be a little nuanced and needs somebody who's a bit experienced, but no, you don't need a battery of testing. They have all these very eloquent computerized testing now, and TOEFLs and all these different ways that they've come out to diagnose ADHD, and none of them have been proven to be superior to the pediatrician looking at a questionnaire from the parents and the teachers and interviewing the parent and this child. I mean, it's just not superior. So no, the short answer is no, Dr. Fierstein. You don't need to go to a psychologist, a neuropsychologist, or a neurologist. It's something that the pediatrician should be able to do, and it's often the diagnosis can be made in 1 to 2 weeks. Certainly not in one session, but it shouldn't take months and a battery of testing to make the diagnosis.
Thank you. Dr. Parles, are there alternatives to medication to help with ADHD? Number one, and then we had another mom whose child is just really disorganized and getting ready to go into middle school and doing well in school, but how do you help that child with organization? The teachers can only do so much.
So medicine and ADHD, the facts are clear and have been now since the middle 1990s. There used to be two camps of experts, one who said that you didn't need medicine and one who said you needed medicine. And, there was a really, really good study with thousands of kids that they had to stop the study early because the kids who were getting medicine were doing so much better than the kids who weren't, that they found it was unethical to continue the study. ADHD is a problem that is caused by an abnormality or a difference in a part of the brain called the prefrontal cortex, which is underactive in people with ADHD. That part of the brain is responsible for executive functions, which Janice mentioned before. Executive functions are the functions that allow us to control our behavior and emotions, allow us to plan and to organize the way we think, speak, make decisions, and act. And those are the functions that are deficient in ADHD and cause the problems that show up as symptoms of ADHD. And since that comes from a biochemical abnormality in the part of the brain, trying to treat that without medicine is not often successful. Not every child with ADHD needs medicine immediately. The younger kids who have minimal impairment, often it's appropriate to wait until they're older, because the younger kids, in the sort of 5, 6, 7 age group are trickier to treat medically. They don't all respond as well. They're more prone to side effects. So if they're doing okay, often you want to wait. Okay. Medical treatment is not the only thing that you need to do. I mean, there are educational accommodations. There is, parent training, parent behavior training. Some kids, benefit from direct behavior therapy. Medicine only is not a good plan, but in general, medicine allows the rest of the plan to work better because it helps to restore the executive functions. So there have been things released like video games to treat ADHD. There's something called neurofeedback where I'm not going to describe it, but it's a complex neuropsychological procedure that kids go to a few times a week. None of them have been shown, so the things that have been shown to be helpful, have not been shown to be helpful enough in the absence of medicine. And in the presence of medicine, they largely become redundant. Okay. So we're still waiting. There may be something that comes up that changes the treatment paradigm for ADHD, but it's not here yet. And the one thing I would say about medical treatment for ADHD and stimulant medicine is the drug of choice, is that that there is no medical treatment for any disorder that any type of doctor treats that is statistically as effective as stimulant is for ADHD. And when used properly, it's safe. And when you have someone that understands ADHD, that can help kids who get side effects navigate away from things that cause side effects and avoid the side effects, the treatment is very well tolerated. The 10-year-old who's disorganized, it's hard to know, okay? But things that can cause disorganization generally include ADHD, which is most common, or anxiety. People who are super anxious, have trouble concentrating, can seem disorganized. The other thing that can cause perceived disorganization is the person who's doing the perceiving has an excess value on being overly organized. So that can be the case too. That sometimes developmentally inappropriate expectations can can lead to the perception of a problem when really what's going on is developmentally normal. I think that that's a good family to ask to speak to their pediatrician, describe what's going on, and ask for for advice at that point.
Thank you. So we did most of our time on ADHD. That's really where most of the questions were. Let's do a little anxiety. Dr. Montague, parents who are seeing signs of anxiety in their younger children, 4, 5, 6, what are some of the things that they can do to help so that they don't become the teenager who needs medication?
All right, so some of that will be unavoidable, I think, just like we were saying that ADHD is in the prefrontal cortex. There's definitely, I saw a question on there about a child that had underlying medical illnesses. And so sometimes, right, there are kids who are medically fragile or have medical illnesses. I think that when they grow up like that, they worry about themselves. Maybe they worry about their blood sugar, or they worry about how they'll fit in, or if they look different, or they have to keep going to the nurse. So I think sometimes we can do behavioral, cognitive behavioral therapy, play therapy with children. I believe in getting a child into family therapy or play therapy really early so that they can learn strategies. And any child can learn a strategy. So if you feel nervous, what do you do? That's basically what a strategy is. It's I feel nauseous, or I feel upset, or I feel like I want a hug from mommy, but mommy's not here. What can I do? And we could use stress toys. Some of these kids have some sensory issues. It's a whole nother talk, but I know that other kids who feel the need to take the pencil and put it in their mouth, or bite their collars of their shirts. And they're sometimes getting them some sensory toys or weighted vests, hats, toys to play with that help them calm them down can help. There's a lot of new books on the market about anxiety. There's a book I have in one of my exam rooms called I'm Fine. It's a picture of this cute boy's face, and it's just about how I'm fine. And a lot of what anxiety is being in the moment, and is about saying what's happening right now. And so reassuring them, are you okay now? How do you feel now? Because anxiety really is worrying about the future and things that haven't happened yet. So if we could teach our kids to be in the moment a little more, and sometimes that's on us because we're always saying a field trip on Friday, and on Saturday we have to go to grandma's, and we have a soccer tournament, and that creates a lot of stress on a kid because they don't know how to manage that. We have to learn how to manage that. And if we can't manage it, then that's something adults need to take care of. So we need to protect them against too much going on in their lives and deal minute to minute, and really try to bring them back to, hey, what can we do to get your mind off it? So distractions are great strategies. Go play outside, do a craft, read a book, play music, whatever they like to do. I think that some of these kids, the busier they are, we don't like to overschedule them, but they should. I mean, I had a child recently, he just comes home from schools and lies around, and that's not good for anxiety because they're just sort of dwelling on it all the time. So not so much screen time, maybe just, limit the screen time. I think that definitely adds to it. But play with them, get on the floor, tactile things, Play-Doh, crayons, things they can really get messy with. Their brain is not functioning what they're worried about when they're getting messy and playing. That's why therapists do play therapy, because games help, and interacting with them on their level, sit on the floor. There's a lot of science that talks about how we as parents come home and we're so busy, we come home from work, daycare, and we forget to sit on the floor with our kids. So let's try to get back to that, hey, we're away from each other all day. Let's throw the coats on the floor and let's just sit and get to know each other for an hour. And a lot of that will help bring down their stress as well. And stress, like we talked about before, leads to anxiety. I don't know, though, that you can always prevent them from being an anxious teenager, because some of those kids that we see almost this hiatus where they might have been a little anxious in first grade and second grade, they do great until the stressors start, high school and sports and social life, and then they get stressed, and it's just sometimes genetic. I tell families all the time, and you know what they say? Oh yeah, well, I'm on meds, my mom's on meds, my sister's on meds. So clearly there's a genetic chemical component, and I'm really not sure that we can prevent the teenage anxiety, but we can definitely help the child while they're young.
Thank you. I'm busy writing a response. Somebody asked about books or websites for teens with ADHD and anxiety. So we will get together a little book list and we'll include it in the follow-up email. So last question, Dr. Lashley. Dr. Parles had mentioned that a lot of parents get diagnosed with ADHD, or they recognize their own ADHD, when the child gets diagnosed. Do you find that with anxiety also? Do you see that tends to run in families? Well, I guess, Dr. Montague, you kind of just said that, right, with everybody being on the same medication. But, do you find that that anxious parents end up with anxious children? And do you think it's nature or nurture, or is that too philosophical a question?
So one of the first things they teach us in training is get a mental health history. And I'm always asking, when I have a patient with ADHD or suspecting, I say, Mom, what is your level of education? Dad, what is yours? And if I find out that somebody didn't go on to college, or tells me that, yeah, they struggled, or they were diagnosed themselves, or had something undiagnosed, that's very telling, because ADHD specifically has a very strong family inheritance. Almost always I'm finding one of the parents has some signs of it, or there's a sibling with it, something like that. Anxiety, we all have anxiety to some degree, right? It's a evolutionary thing we need to have, to be afraid of predators, and to be, a little bit on the lookout like a squirrel for, the bear, as Janice was saying. So all humans have anxiety, which is healthy. Heightened anxiety can run in families. It's just not as strong as ADHD, but people with anxiety disorder can often have a family member who has depression, anxiety, bipolar disorder. So we're always getting mental health histories on families when we're treating. Another thing I'll ask is, if somebody was diagnosed, what medication were they given? And I'm more likely to use a medication if one is indicated. That someone in the family has taken, because we now are finding genetic ways that people metabolize their medicine, and you're more likely to respond to a medicine that someone else in your family did well on. I don't want to give the impression that we're medicine happy. I know a lot of people out there are leery of medicine as a first choice of treatment. With ADHD, and I've been answering some of these questions in the chat box, under the age of 6, it's very clear, under the age of 7, it's very clear that behavioral management is the first way to treat ADHD, unless it's extremely severe. But over the age of 7, all the studies that Dr. Parles alluded to have shown that medication is the mainstay of treatment for ADHD. For anxiety, how do we decide who needs medicine and who doesn't? Well, it depends on the severity and the functioning. If someone comes to me and they're functioning really well in school, but they're still a bit miserable with anxiety or bothered by anxiety, I think most doctors would start with a therapist. And it's only when somebody says, I'm so anxious, I can't function in school, I have to throw up when I have to go to school, or I have tests, or I'm afraid to leave the house, or I'm having impairment with my social interactions, that's somebody who needs medicine now. So we can't just wait for therapy to kick in. And I know we're not talking about depression today, but it's really the same. If somebody is sad, it doesn't necessarily they need medication. But if someone says, I'm contemplating suicide, or I'm so depressed I can't function in school, that's someone who needs medicine now. So that's how clinicians decide who needs medicine and who doesn't. Except for ADHD, it's the age limitation. And if someone is effective, medicine is the way to go for that.
Great. I'm going to give every panelist a chance to give their final thoughts. Let's start with you, Dr. Montague.
All right. Well, I think that we learned tonight that these things are pervasive. In fact, I think a lot of families, especially anxiety, being that we have this heightened state right now. So let's remember to be in the moment with our kids. I know that you've heard it and everyone's heard it before, but I think we really need to remember to be in the moment, play with them, enjoy them, make dinner on a weekend so you can put it in the oven on a Monday night and play with your kids, be with them. I think that lots of kids' anxiety comes down so much when a parent is just emotionally there. And the caveat to that is if you don't feel like you can be emotionally there, then the parent needs therapy, right? So don't be afraid to reach out to your own doctor for therapists, because I think that if parents can get themselves in a good place, we can be the best for our kids. But to recognize it, to ask your school for help, to ask your pediatrician for help. There are early intervention services, there are child preschool services to get evaluated, and there are other places that are not that pricey that you can get good evaluations if you don't find you're getting help from those sources. But to be on the lookout without being too nervous that you're missing it, because chances are you're going to, as a caring parent, really know that your child needs help and reach out to your pediatrician.
Thank you, Dr. Parles.
There is no stigma.
I love
Yeah,
that.
I think that's something that you can just leave right there. I agree.
Hear, hear.
And
I have a feeling Dr. Lashley's not going to be as pithy.
Yeah. I think final thoughts are right now, and I wrote this in my chat box, we're all on our last nerve. COVID is an extraordinary time. And I can tell you everyone on this webinar, panelists as well as participants, are experiencing stress. And one thing that is very important for us as parents, we have to project calm. We have to let our children know we've got this, that you are safe, your mom and dad are there to take care of you, and that even if we don't feel it inside, we're gonna project that. And our children pick up on these things. So it's so important to let them know we got their backs and that their environments are safe, and that just give yourselves a break. We're all having a hard time, and resilience, as one of my mentors, Dr. Foley, says, resilience is the norm. We're New York strong. We can do this. And if we work together, we're going to get through this pandemic together.
Thank you. And, thank you to all our panelists. It looks like we got through at least 35 questions in the typed, and then all the ones that we went through. I want to thank everybody for listening through to this. If you are calling your pediatrician's office for help with this, I'm going to ask you to please be kind with them, because we are all stressed and overworked and doing lots and lots of COVID testings at the same time that we're giving flu shots and all those other things. So please be nice to us. If you are worried about the vaccine, and that's one of the things that's on your mind, we are going to have a vaccine webinar for the younger children. If it's getting approved for ages 5 and up, we will have some information for you, so you can look for emails and social media on that as we get more information towards the end of the month. Thank you, everyone. You will get a copy of this webinar, so that way you can kind of replay some of these wonderful answers, and we will include a list of books and other sources that can be helpful to you. So thank you so much. Thank you, Dr. Lashley, Dr. Parles, Dr. Montague. Thank you, Bree, and all of Allied for helping to set this up. Good night, everyone.